Peyronie's disease is abnormal curvature of the penis or narrowing of the penis, and for some people, both. This can result in decrease in confidence as well as change in physical cosmesis of the penis and even difficulty with penetration. Most patients don't have an exact event which would have caused their Peyronie's disease. Few patients can say, I suffered a penile fracture and that's when it all started. The majority of patients experience Peyronie's disease or abnormal curvature or narrowing of the penis, which has been developed due to repetitive microtrauma, most commonly due to erectile dysfunction. You can imagine that if someone has weaker erections, that with penetration, this may cause buckling of the penis, and this type of repetitive buckling can cause inflammation, scarring, and therefore physical changes to the penis. Peyronie's disease can affect patients both physically as well as functionally and psychologically. Peyronie's disease itself, due to the scar tissue, can affect the blood flow within the penis, which can cause erectile dysfunction. You can also imagine that due to the curvature of the penis or physical deformity, many patients might have decreased confidence, which can cause a psychogenic-based erectile dysfunction. And you can imagine that these issues with weak erections, as well as abnormal curvature of the penis, can make penetration difficult both for the patient as well as both the partner. Peyronie's disease is first diagnosed based on patient history. In addition to history, we also need to perform a proper physical exam to evaluate the penis for any type of development of scar tissue or plaques that might be able to be felt. Not all patients will have a plaque that can be felt on exam. Therefore, it's very important for us to often perform an ultrasound of the penis to see if we can identify any additional plaques. Lastly, although photographs may be helpful to identify the direction and curve of the penis, many patients feel uncomfortable performing this type of evaluation at home and bringing it to the office. Therefore, we often perform an injection into the penis to induce an erection so that I can evaluate the curvature of the penis with the patient face to face, and so we can see how we can best proceed with treatment. There are a variety of treatment options for Peyronie's disease. These can vary from oral medicines to traction devices to injections and even procedures. However, it's important to see an expert in Peyronie's disease to help evaluate whether you're in the active phase or in the passive phase and to determine which treatments should be performed and at what time. We determine the best treatment for each and individual patient after performing a detailed history, physical exam, as well as a discussion determining what the patient wants to achieve and what bothers them most in regards to the curvature or the cosmesis or the erectile dysfunction. You can imagine for some people who have good erections, they might just need to improve the curvature alone. However, for some patients who suffer from both erectile dysfunction and curvature, they may be best served with more aggressive treatments, such as plaque incisions to remove the plaque, as well as penile implants to improve the erectile function. There are several consequences for those who decide not to treat their Peyronie's disease. First, patients will continue to have decreased self-confidence due to the change in cosmesis and change in sexual function. However, you have to think functionally. If we're going to continue to have sexual intercourse with a curved penis, this can result in continued trauma to the penis and perhaps further injury.